The enhanced premiums tax credits for individual health insurance plans purchased on the Affordable Care Act exchange marketplace are set to expire at the end of the year, leading to higher out-of-pocket costs for insureds. Here to discuss impacts on health insurers is Jason Hopper, Associate Director of Industry Research and Analytics at AM Best. And Jason, ACA enrollment has jumped since 2020, especially last year, 2024. Are premium subsidies what's driving that?
Sure, thanks, John. Yes, it definitely has an impact on rising enrollment, right? Helping keep premiums down, which was passed after COVID-19. And the economic hardships that had followed. So this is a way for consumers to help be able to more afford their health insurance. One of the other driving factors is Medicaid redeterminations, which began in 2023. So what that causes a reduction in membership rolls on Medicaid. And we have seen, at least in the 2025 open enrollment period, a shift from Medicaid, these enrollees, into the Affordable Care Act marketplace exchange. And contributing to that, as you noted, is the premium and HECS tax credits.
With that shift that you were talking about, jumping from Medicaid to the ACA, what are the implications?
Yeah, so Medicaid enrollees typically are higher morbidity. So with more members flowing from Medicaid into the ACA, we are seeing that morbidity shift as well. So morbidity is getting worse on the ACA membership. We're seeing more behavioral health claims. We're seeing more home health claims and other dynamics that are typically synonymous with the Medicaid population. And this is on top of a typical rising medical cost trend that is being felt throughout the health insurance industry on a variety of lines.
Has the ACA marketplace business been going well for insurers in the last few years, and how will they look at it all going forward?
Yeah, so the last few years have been an interesting time in history, obviously, with COVID-19, right? 2020, no one really went to the doctor as hospitals were shut down and things. So that increased profitability. All that pent-up demand flowed through in 2021. So you saw larger underwriting losses that year, and has gradually gotten better in 22 and 23. And now we saw this dynamic happening in 24, which pressured results and pushed underwriting profitability down from 2023.
If subsidies are passed later, what will be the burden on carriers, Jason?
Yeah, that's an interesting question, right? Open enrollment period is still going on. Would that be extended, right? That's one question. Number two, it's likely that the vast majority of consumers are unaware of the premium tax credits enhancements being eliminated. So with that, insurers would have to go outreach to all these individuals that have chosen not to renew their health insurance this year. So that would be a big undertaking for insurers to get those potential enrollees back. And inform them on the newer, lower price points that would occur because of the subsidies passing again. But that remains an open question at this time.
Thanks, Jason.
Thanks, John.
That was Jason Hopper, Associate Director, Industry Research and Analytics at AM Best. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.